Victoria. I'm going to be doing an EKG on you, and EKG measures the electrical activity of your heart. So if you lay back, your two identifiers. Can you verify your name and date of birth?
My name is Kerry Bernard, and my date of birth is 04/20/1971.
Alrighty.
Okay.
So as I said, we'll be doing an EKG. It's not going to be painful or anything. You always want to approach the patient on their left side. Each sheet should have, exactly 10 stickers on it. So you start with the left side, and I'm gonna do the outside of this arm. So when you put the electrodes on, the ones on your arm and the precordial leads, they always point down. The ones on the legs or the ankles, wherever you want to put them, they always point up. And the tabs, they've got like this gel on them. You want to make sure you don't get the gel on the place that doesn't have anything on that, because that's where the leads are going to attach to, and there's any gel on them, they're not going to read correctly. And then you want to make sure that you don't put it where a muscle is anywhere on the arm or on the calf. So there's the left arm. And then pull your pants leg up. So then you want to do the inside of the calf. So there's his calf muscle. So anywhere through here will be good. You want to make sure that they're laying flat, because if not, then they're not going to read correctly. So then you come on over here, and then I come down and then work my way back up. See, pull this leg up, and then you want to make sure you're as close as possible as being in the same location on each arm and leg. So then we'll do the right arm. And he's easy because you can see, where the muscles, kind of dip down. So you'll put that right there. Make sure they're tight and everything. So V1 is going to be, you're going to be in the second rib, fourth intercostal space. So you can feel his ribs. So you'll count down. 1, you'll feel space, so that's not a rib. 2, space. 3, space. 4. So V1 will be right there. V2 does not have, an anatomical location. It's directly across from V1. Then you come on around. You're going to skip V3. You're going to go to V4. V4 is going to be your mid-clavicular line, which is, you can't really go off. You may want to stay on the mid-clavicular line, but some patients you can go the middle of the nipple line. But if they're heavier chested women, the breasts are going to be kind of on the side. So you want to do mid-clavicular line in the 5th intercostal space. So there's the 4th, your space, 5th, and you come over to mid-clavicular, and then you place your electrode. Then you go back to V3. V3, you're going to just put on a diagonal from V2 and V4. So about right there. Then V5 is going to be the antecubical space in the 5th intercostal. So about right here. It's going to be in line with like the crest of your armpit. Axillary, yeah. And then V6 will be your mid-axillary line. So about mid of the armpit. So it's going to be kind of on the side. And it's also 5th. Yeah. It'll be 5th intercostal space. So you got your electrodes on and everything. Then each machine is different for, the information information and everything like that. So we'll do that in a second. Alrighty. Precordial leads are your V1 through V6. They're always brown. So Bobby Brown is your precordial. Your left arm and your left leg is going to be smoke over fire. So red over black. So you got smoke over fire, Bobby Brown. It's a little mnemonic that a lot of people normally go by. So, pull these up. And then you can ask the patient if you can lay your leads across them. Is it okay if I lay the leads
Yes,
across?
that'd be fine.
See if they don't fall off. So you lay the leads. And every lead, it's labeled, but sometimes the labels, the writing wears off after a while. So you want to know your colors. So smoke is your left arm, smoke over fire, black over red. So what you do is the place where you held to put the electrodes on is where you're going to clamp your leads onto. You want to make sure your leads do not get into the gel because it will interfere with it. Your left leg is red for fire. So you just clamp it on just like that, and they're very, very easy to clamp. Snap it down, and then you come on around the patient. Alright, right arm and right leg is snow over grass, so white over green. So your green is your grass, and that's your leg. Clamp that one on. Then your white, which is your right arm, you will clamp this one. Alright. And all your precordial leads, you know, they're V1 through V6, they're all labeled. You know your precordial leads. So here's V1. Now if you have a woman who still has like a sports bra on or anything, you can ask them if you can slip the leads underneath the bra so that way they're not pulling up the leads when they go over top the breast. And also with the woman, if you have to lift up the breast, always lift with the dorsal aspect of your hand. You never want to grasp the breast because then sexual harassment could come and bite you in the butt. So V1, V2, and then you lay them across all around. You never want to overreach on a patient. V4, you can, you know, place the leads on. You can attach the leads to the electrodes at any order. It's really no specific order, just as long as you place them in the correct order so you won't get confused of where you're putting them at. Then V6. Alright. And then this machine in the bottom left-hand corner, it would kind of read, it will say sensors or okay, or it will tell you like fail V1 or fail right arm, so that way you can go fix it before you run your EKG. So this one has the patient button. You'll click on the patient, you'll enter their ID, their last name, first name, date of birth, all their information, and then once you're ready, you're going to hit this ECG button. So before you hit that, you want to make sure you tell the patient to remain still, that you're running an EKG, and if you know they move, then it's going to be, you know, it could be artifacts in there. So I'm going to run your EKG. If you remain quiet and still, you hit the button, and it would take a second to read it. I bring it down? Okay. No, it did not. So here's your EKG strip. So then once you know, if you're working doing EKGs and stuff, you'll get to really look and see how they should look. So you'll quickly look at them, and if you know that there's something wrong with them that has something to do with the leads, then you'll adjust the leads and then take another one. Because if a doctor sees something that's, visibly, wrong to the eye that has something to do with the leads, he's going to reject it. Then you have to go back into the patient's room and take it all over again. So it's better to correct your mistake while you're in there. So after that, I'm going to run another one because for some reason it cut this one off. So check this nothing. All the leads are okay. It didn't print off all the way. Alrighty, it's going again, so if you remain still and calm. Okay, well, I guess. So then when you go to take your leads off, you just unclamp them. There is no specific order. You lay them down. And like I said, never overreach a patient. So you just work your way around. Now because the electrodes, they've got really sticky adhesive on them, you can, ask the patient if they would like to remove them, or if you remove them, just be very gentle, especially with an elderly patient, because they can easily rip their skin off. Now, the ones at school, they're not as sticky, so you can just kind of rip them right on off. And you want to make sure you pull off all 10. You don't want to leave one there. And that's that. Is anything you need to add? Okay. And another thing is when you're, in a hospital or wherever you're doing EKGs, if they have a gown on, whichever side you're not working on, you want to cover that side back up so you don't leave them exposed. So that way it keeps them, it keeps their privacy. Do y'all have any questions?
Thank you, Victoria.
You're welcome.